Medurstand-Understanding Medicine.
Professor Aziz Rehman from Medurstand, and I'm going to demonstrate the method of checking glossopharyngeal and vagus nerve. These are usually done together. They have this mostly motor function. They supply our palate, they supply the pharyngeal muscles, and they also supply this cheek muscle, and they are very important in swallowing and the way our speech is formed. So I think that is very important. And the first thing is that if somebody has the vagus nerve has got very complex function, and we just will test the function related to the pharynx. So how do we do this? First of all, I like to look into his throat. In a normal person, the palate should be normal, equal, and on both sides. But if one side is paralyzed, that may be drooping, right? And if one side is paralyzed, the central raphe, which differentiate between the two sides, that might be pulled to the healthy side. Okay, and when I ask him to say ah, the healthy side will move up, the disease side might not. Okay, so this is how I'm going to open this sterilized tongue depressor. इधर देखिए जरा प्लीज, मुँह खोलें. Palate is central, is not drooping. Central raphe is also in its normal position. Say ah. So when he says ah, palate rises symmetrically, equally on both sides. Then we have to do the gag reflex, and with I think I'll just explain the method. You have to do gag on both sides. Open the mouth, please. Open it. If you touch the pharynx, he should gag like this one. So we test the gag reflex on both sides. This is not very aesthetic, might skip in normal practice, but if suspected, you may do this test also. So you do it on both sides. So one simple way of assessing this glossopharyngeal and 12th vagus nerve is patient's speech. Patient would develop a nasal twang in his speech if the palate is drooping. So I think from that we can also judge. From the symptom, patient might be complaining of food going into the nasopharynx while he swallows, or the fluid going into the nasopharynx, or patient might complain of actually swallowing difficulty, the neurological dysphagia, that may be a symptom. And then there may be drooling of saliva also. So I think all these things, and patient might develop a bout of cough during eating because some food goes into the trachea, and that precipitates a bout of cough. This is how we test the vagus nerve and glossopharyngeal. Thank you.